It's just over 2 weeks since we entered Tier 4 on Boxing Day, and 6 days since the Prime Minister's announcement of another national lockdown. And over that time, we've seen a worrying increase in cases across Suffolk, from about 2,000 per week to 4,000. The health service is under considerable pressure. Therefore, Suffolk needs you to stay at home. We need to think back to that first lockdown and how we behaved over that time. If you do need to leave your home, then stay local, minimise your contact with others. The fact is that this new variant is more infectious, and I know that many of you have been trying your best to keep to the guidance, but all it takes is one dropping of the guard, a quick catch up with somebody, and the virus can spread. We need to imagine that either ourselves or others are carrying the virus and behave in that way. If you have symptoms, I'd ask you to get tested, and if you test positive, to work with our national and local contact tracers and follow the guidance and self-isolate for 10 days. Suffolk will support you to do the right thing. If you're concerned about money, then contact your local authority that you pay your council tax to, as there are funds there to support people to self-isolate, especially those on low income and maybe those receiving statutory sick pay. If you're worried about practical support, maybe you provide and do chores for a relation or for a neighbour, or you even have an issue such as needing to walk your dog, then contact Home But Not Alone. They may be able to put you in contact with a local volunteer to help you out. The reality is, if we don't follow the guidance, if we don't reduce our contact, we could end up in more stricter lockdown measures. But the positive thing is there is a light at the end of the tunnel. We've recently authorised the use of the third vaccine, Moderna, and the national programme is being rolled out. We do need to do everything now that we can to follow the guidance and to protect our loved ones and the other residents in Suffolk. Thank you.